Welcome to episode 3. My name is Jason and my lead point is politics. This time I'd like to get a little bit more into a specific issue. One of the most discussed topics right now is healthcare reform. First off, I know that this can cause a big debate either way, but I'll try to use reason to get my point across. I've already spoken previously that I'm a believer in the system of capitalism. This country was founded with its principles and has succeeded mainly due to it. Capitalism's success is also dependent on freedom, which is our other value component that has made this country great. In the last several months, we have seen attempts and some successes in bringing down capitalism and also freedom. No, it's not new in 2009, but the war has been escalated during this time. Healthcare in the United States, with all its issues and troubles, is by far the best system in the world. Though demonized, the U.S. drug companies have come up with the most innovations in medications than anywhere else in the world. The problem is not the healthcare system itself, it's insurance. Is it possible to insure everyone, especially those who can't afford it at its expenses, at the expense of the rich? Now, emotion would say, how could you be heartless and want someone to be uninsured? Do you want them to die? Well, of course not. The problem is that when we think we can have government solve all our problems, we surrender our freedoms and our wealth to the large federal money pit. I can't think of one thing that the federal government has done that has been cost effective enough for me to want to entrust it with more responsibility. I've been asked if it has to be cost effective to be considered successful. Well, not necessarily. But for example, when it comes to the military, giving them all they need to defend and protect us, it does make sense no matter what it costs, because it's a constitutionally mandated function of the government. Healthcare, on the other hand, is not. Once again, I do realize emotion on this, that the subject does cause. I just don't want that to cloud good judgment. What good will it be if we decide to bring about a public option and it bankrupts us? Socialized medicine, yes, that's exactly what we would be adopting if we go forth with this, so that everyone can be covered, but with price controls, added servicing equipment taxes. For instance, the Pelosi bill recently passed in the House includes a 2.5% excise tax on the wholesale prices of medical devices sold in the United States beginning in January of 2013, meaning that medical technology industry would face a $20 billion tax over 10 years on many of its products, which would make the cost go higher for everybody. I mean, they're going to pass that along to us. There's no way to get around that. And I'm just thinking about, wait, I thought that they were trying to make this more affordable for us. Well, for those who can't afford it, we put it on the backs of the rich, and where do we decide that? Who's rich and who's not, and where does that line cut off? We've seen that escalating down to where everybody who has a job may be considered rich eventually. Why does that create a problem? I mean, they do create the jobs for the rest of us, unless you know someone who's got a good job from somebody who's poor. No? No? Okay. The cost of the Pelosi bill is estimated to cost over $1 trillion. These people have been trying to sell us a bag of goods that this will somehow be deficit neutral. That is absurd. I mean, think about it. And really the only way that they can possibly claim that is that they're going to start collecting the taxes to pay for this right away. But the program doesn't actually start for another 4 years if it's passed. So what happened to the urgency that we needed to get this thing passed right away because people are dying when it's not going to start for another 4 years? That doesn't make any sense to me. I thought it was an emergency, but it's kind of hard to say. This is just the beginning. Once you have the multiple layers of bureaucracy in the government healthcare department, which is going to happen, you have to go through all that bureaucracy just to get a decision, and you thought your HMO was tough to hassle with. Just wait. Did you know that those in Great Britain who are diagnosed with a treatable colon cancer, by the time that they can get into a place to receive the treatment, 20% of them have become incurable? In France, in addition to the taxes taken for healthcare, 85 to 90% of the French also buy private insurance to be able to obtain just adequate health care. I mean, is that something we really want? I can't imagine why we would want that. To pay taxes and then, over and above that, have to supplement it anyway. That's further evidence that the government cannot provide the best care. To answer the question earlier, no, I don't believe it's worth bankrupting our country to claim we are insuring all Americans only to make us all have the same horrible health care. I won't claim that I can come up with the answers on healthcare reform. I can't solve it all myself. I won't even attempt to say that I have all the answers. Because I can acknowledge that there can be some things that can be done to help. And so some suggestions that I've heard are tort reform, limiting the payout on lawsuits for healthcare issues. Sure, I believe if there was actually something that was negligently done to harm a patient, there should be compensation for it. But I think as a whole, we've become all too happy to file a lawsuit in this country. Because of this, doctors must have expensive malpractice insurance. This, in some cases, is causing doctors to actually leave the profession because they just can't afford them. Insurance reform, I believe, that we can make it so that any company can compete in any state for your business in insurance. We don't have that right now. And, in some states you can only get one or two different insurance plans mandated by that state. Now, if we reformed it, we can actually make it so that they can actually compete with anybody in the country, which would drive down prices. This would not be my optimum solution, but another is to set up health spending accounts. That itself is a good idea. However, taking tax money to fund it for the ones that are poor, even though that's not my favorite idea, it would make more sense than just taking over the whole healthcare system and causing that to be government run. Now, there can be debate on how we decide who gets the money to be put into those health spending accounts, but it'd be much a simpler discussion and more handleable. These accounts would put the responsibility in the hands of the consumers, the patients. If we can see exactly what our healthcare costs are, we can shop around and look for the best value at lower costs. That doesn't mean we're going to diminish the care that we get. It just means that we can force the doctors and the other healthcare providers to compete for our business. And if we know what we're spending, we can say, hey, is that really necessary to be done? If it's not, then we can cut it out and you've lowered your costs. I know there's some who have tried to tell me that healthcare reform in the works is not a government takeover. However, things I've come across would hint that is not the case. In a USA Today article that was titled "Historic Obama Backed Healthcare Passes the House," it states that the legislation would require most Americans to carry insurance and provide federal subsidies to those who otherwise could not afford it. Large companies would also have to offer coverage to their employees. Both consumers and companies would be slapped with penalties if they defied the government mandate. That sounds more than just trying to help. That sounds like an attempt to dictate and control. Also, it states that at its core, the measure would create a federally regulated marketplace where consumers could shop for coverage. In the bill's most controversial provision, the government would sell insurance. Although the Congressional Budget Office forecasts that the premiums would be more expensive for the government-sold policies than for private companies. Okay, now, if it's meant to reform and hold down the costs, what good would it do to sell the insurance at prices that would be higher than private insurance could sell? Except for one thing, the very reason the government should not be involved in private industry is because of price controls. They have the ability to set the price at whatever they want. So when costs go up, and it will, as demonstrated through the taxes previously mentioned, the government will artificially keep the prices low, which obviously fiscally responsible private companies will not be able to do, and leaving the government option being the only game in town because the other companies can't stay in business. It may not start out as a complete government takeover, but with the unfair competition of the government insurance, that's where we're headed. I welcome your questions, comments, suggestions that you have. You can send that to theleadpoint@gmail.com and put my name Jason in the subject line. My name is Jason and my lead point is Paul.